I haven't got a foot fetish. I thought this morning we'd talk a little bit about, is your big toe causing you pain on the inside of your knee? So in your foot and ankle, lower limb, you've got something called the Windlass Mechanism. And the Windlass Mechanism is basically a connection between your calf muscles, your Achilles tendon, the plantar fascia on the bottom of the foot, and then all your toes, but primarily your big toe, because your big toe has a really important role as far as propulsion is concerned. That means pushing you forwards when you're walking or running. Now, as a result of a number of things, so you might have been one of those unfortunate people that as you're unracking the weights from the gym, you end up dropping that 20 kilo plate on the end of your foot, as Mrs. Mofo and myself both done, and carried on training with a soggy shoe, setting stereo. Or you might have some issues going on with the first metatarso-phalangeal joint, which is this joint here. So if you're having to wedge your feet, ladies, guys, if you're having to wedge your feet into tight shoes, what you'll find can happen is something called hallux valgus. And hallux valgus is where your big toe starts to drift across and laterally deviate across the other toes. Now, it's not just aesthetically looks a bit strange, it also starts to affect movement of the big toe. Now ideally, and this is how we wouldn't assess this in clinic, so normally we'd be doing this in a standing position, ideally we should have 45 degrees of big toe, what we call dorsiflexion, as we go into our stance phase during gait. As you can see, Mrs. Mofo has an issue on her big toe and has some medial knee pain, and as you can see has very limited big toe movement. Now, one of the things you're going to be looking for on yourselves as far as this is concerned, and you probably can't see this, but Mrs. Mofo has a callus formation, some hard skin formation just on the inside of the toe here, and that's caused because as she's going into toe off, rather than a big toe coming up like that, she's literally having to try and screw her foot off the floor in order to create enough movement to blow off some of the tension that's starting to create as a result of this instability. And as a result of that screwing the foot off, she starts to transfer force up into the medial side of the knee, the inside of the knee, and then up here we've got a number of ligaments, one of which is your medial collateral ligaments. You've got a little disc inside the knee called the medial meniscus. Once we start to do that rotation movement, we start to overuse those structures, and then you start to get knee pain. Now, a lot of you may have had this for a period of time and have noticed that this starts to come on. You know, there's quite a few guys now prepping for shows, cardio's nice and high, and I think the assumption might be that as a result of the increase in cardio, that you're now starting to get knee pain as a result of that. However, that may be the case, but it might be due to the big toe biomechanics, and over the next couple of days we're going to show you some videos, some exercises that will help to address big toe movement, tension through the Windlass Mechanism, that's that connection between your calf, your plantar fascia and your toes, and then hopefully alleviate some of the issues there up at the knee. So if you straighten out your foot for us, Dan, so that's Dan's end of range there, that's disgraceful.
It's not my fault.
Well, whose fault is it then?
My mum's. She's got dermatitis.
So that's Dan's range of movement at the start of this process, and we're going to do 3 pieces and we'll see if there's been any improvement, knowing Dan there won't be, at the end of that. So piece number 1, you're going to pop this underneath your calf, Dan, and then typically what people tend to do when they're using foam rollers is they'll roll backwards and forwards. I prefer to use more of a side to side action. So what you're going to do here is you're going to roll from side to side. Ideally we're going to start either at the bottom of the calf and work up to the top, or start from the top and work down to the bottom, finding the bits that feel tender and then camping out there for a few seconds until it eases, and then moving on. Now if you find a bit that hurts, which is a bit there, just pull your foot back towards your knee and then straighten your foot that way and just camp out there. This is called an active release.
It hurts like a bitch.
It
Does.
This is we have this conversation all the time where she says women have got really high pain thresholds.
Yeah, but the pain sensitive.
The minute she gets onto the foam roller or the lacrosse ball, she's squealing like
I'm
a
a
bitch.
sensitive flower.
Okay, so that should have eased by now. So roll around a little bit more, find a little bit that hurts.
What? Move it
So
down.
that's piece number one. Now, if you've got a super friend, you can do this with some pressure onto your calf. She's such a fucking god. So roll down and then roll through. So in this position, foam roll your calf muscles. 60 seconds. That's piece number one. So piece number two. I'm using this because I haven't got a lacrosse ball with me, and it was all that was in the fridge.
But you don't normally drink that, do you?
I wouldn't drink this
No.
poison. This poison. Can on the floor. We're going to use this now to. We've loosened off your calf, which is one part of the windlass mechanism. We're now going to roll forwards and backwards on the bottom of the foot, and we're going to start to loosen off the plantar fascia. Now the can works alright, you could use a bottle of water, you could use something of that diameter. Personally, I prefer to use a lacrosse ball because it inflicts maximum pain and maximum specificity of that pain. It's a big word, isn't it? It's a long word for me. I'm very eloquent, aren't I? And we're going to camp out here, and again do the same thing. When you find a bit that hurts, stop, spend a little bit of time just putting some pressure on, oscillating forwards and backwards, but make the oscillations smaller until that eases. And then, once you've done that for 60 seconds, we're going to move on to piece number three. We're now going to do some direct work to start to work through the big toe, plantar fascia, and all the way up into the calf. So we're going to combine all three things that we've just done. So, sitting back onto your heels, put your hands onto the floor for me, Dan. So you're in a doggy position. And then you're going to just gently oscillate your weight forwards and backwards. We should bring on our OnlyFans site page.
Why do I feel strangely vulnerable doing this?
Because you are strangely vulnerable. So we're going to spend some time in that position. And again, 60 seconds, 90 seconds here. Shouldn't be painful, you should just get a sense of deep stretch. And then if you come back down onto the floor, back into your sitting position like you were beforehand, and then you move this gammy leg out of the way, put this leg straight forwards, and if we look at the big toe movements, you can see we've probably got another 15 to 20 degrees there. So we're closer to the 45 degrees that we need for effective toe off. So if Dan was to do this every day, 10 minutes a day, which is probably all it will take, that hard skin formation, which is a result of the fact that she's having to screw her foot round, which is then placing stress onto the knee and irritating the knee joints, that would reduce because she'd then be able to toe off effectively. The knee pain would subside, job's a good one.